today, for my case study neuro video, I decided to do my case study on a 35-year-old male who has a stroke on the left side, which is affecting their right side. And the deficits with the stroke is walking and balance. They tend to have sensations of numbness, tingling, and weakness. But today we're going to focus on improving their range of motion and by reaching for different things. And basically the occupation I chose is shopping. So that way the stroke patient, since he's 35, he's still young, needs to improve these skills so that way he can still shop independently once he's out of treatment. So basically today the patient will be learning safety skills such as balance and how he's going to shift his weight. So the first thing I'm going to start this out as is they're sitting and then they're going to try to reach for different things. So as you can see, I have cans of food, I have a jar, I have caramel apple and some pasta. So it's kind of like, I decided to start with sitting because I thought that would be the easiest thing. That way they can learn to shift their weight while they're sitting, so that way they can learn how to do it while they're standing. And also it's easier for balance wise, so that way they can learn to grab the table to reach for things. So basically I just have them sit, just grab things and bring it to them. Like if it's too deep in the aisle or in the shelf, they have to reach and grab it. Or even if it's just right here, they just learn to grab it. And different textures, different materials, they'll learn how much they need to grab, exactly how much pressure they need to grab it. It's a lot of fine motor. And then, what I'm going to do is standing, and basically, so that they'll learn how to stand at the counter or how to stand at the shelf. And basically they'll be reaching and grabbing everything. Same thing, different textures, different weights, different fine motor stuff. And then, yeah. Okay, so the next one is you're going to basically trying to grab from the top shelf, or as for this instance, grabbing from the cupboard. So basically they'll be reaching up, bringing it down, using different arms, maybe putting their hand so they can balance easier and be able to grab up here, bring it down, maybe put it in a cart. Yeah. So for the next one, they would practice going down to the bottom shelf, or in this case the bottom cupboard, and they would have to have good body mechanics. And with a stroke patient, it might be even harder for him to reach down. So obviously with this grading technique that I've been doing, this would definitely be later in the treatment to a point where he could crouch down. So basically you crouch down, you grab it, maybe stand back up, and then put it in his cart. So for this patient, he's a 35-year-old male. He needs to improve his skills. And with the different textures, different weights, you could grade that from simply something lighter to something heavier. Obviously, I showed how to grade from different heights and degrees and different reaching, going longer and shorter with his reaches. To adapt this, if you really needed it, I would use a reacher. That way he could get something even farther that he couldn't reach, or if he couldn't crouch down, then he could use that too. But obviously, since he's a 35-year-old male, he should learn to improve over time how to be able to grab things at certain angles and degrees. And that's all I have for today, so I hope you enjoyed my video.